So, kind of knowing what everything's come across as far as the CDC decision lately, what is the top priority for your office right now?
Well, look, we have an opportunity right now to get 28 million kids in this country, ages 5 to 11, vaccinated now that they are made eligible by the most recent CDC decision. And we've been working for weeks now with states, with local health departments, with doctors' offices, with hospitals, with pharmacies, community health centers, schools, to make it as easy and as convenient for parents to be able to get their kids vaccinated. So we have millions and millions of doses in thousands and thousands of locations across the country where parents can take their kids and get them vaccinated.
Amazing. Doctor, one of the things, if I can get a little bit North Carolina centric with this, part of what we're doing here is every 30 days, school systems must re-examine their ordinances as far as face coverings. Last night I was listening to several of these board meetings, and now things are changing with the advent of those vaccines for the younger age group. One of the things I heard brought up was someone called them controversial. Is there anything being done by your office, or maybe it's someone else, as far as fighting some of that vaccine misinformation?
Well, look, vaccine misinformation is a big problem that we've been dealing with as a country. And unfortunately, it has cost lives. We know that people want to get answers to their questions, that it's important that we provide people with answers that are based on science, based on data. And unfortunately, there's a lot of misinformation out there. We know that the Surgeon General has issued an advisory on what can be done to actually prevent misinformation, what each one of us can do, what businesses can do, what social media platforms can do, what media, traditional media can do, doctors can do to be able to fight that misinformation. And we have to do everything we can to be able to give people facts, give people answers, and empower people to be able to tell when they're getting misinformation, how to fight that, and where to get the right resources and the right sources of information.
Exactly. One of the things I wanted to also ask about, I know in a perfect world, the timeline, if I were to ask that, would be something like we want to get everyone is vaccinated as quickly as possible. Is there any sort of timeline that you're thinking right now as far as with Thanksgiving coming up, Christmas coming up? Are there any kind of goals as far as percentages, or is that something not really on the board at the moment?
Well, what I can tell you right now is we have about 28 million kids in this country who just became eligible to become vaccinated, 5 to 11 years old. So we'd want to do everything we can to get as many of those kids vaccinated as possible. At the same time, we have about half of adolescents, 12 to 17, who are eligible and have been eligible, but they're not yet vaccinated. So we have to make sure that they are getting vaccinated. We have about 20% of adults who are eligible and they've been eligible for a long time and they're still unvaccinated. So we have to do everything we can to get as many people vaccinated as possible. We know that every time we have a shot in someone's arm, that's one more person that's safer. That's one more family that's making a step towards getting back to normal. And that's one more community that's trying to put this pandemic behind us. So we have a lot of work to do, and we have to get as many people vaccinated as possible.
Absolutely. Doctor, is there anything else you wanted to add that maybe I didn't think to ask?
No, thank you so much for having me today.
On Monday, here at the administrative office, the Asheville City Schools Board of Education voted to utilize federal funding for a one-time bonus for teachers and faculty. They're hoping to attract new employees while retaining the ones they have. Asheville City Schools' final pop-up job fair of the year taking place Tuesday. Turnout not what Dr. Mark Dickerson hoped for.
As you can see, not a lot of attendance, but we've had one or two to show up.
But the assistant superintendent of HR at ACS, hopeful the district's new hiring approach will lead to long-term success.
Every person that comes in, we have given them consideration, and I think for the most part, we've hired those who have shown up for previous job fairs. So.
Right now, ACS has about 60 openings.
We're looking for child nutrition workers, custodians, maintenance workers, a variety of people to join our family.
On Monday, the Asheville City Schools Board of Education approved American Rescue Plan ESSER funds to be used for a one-time bonus for teachers and staff.
All in favor, say aye. Aye. Any opposed? Motion carries.
Bonuses dependent on certification and hours range from $1,500 to $3,500. New hires who start in 2022 would be eligible for half of those bonuses, says Dickerson.
We're just excited to be able to do this because our employees work extremely hard, and This is just a small token of our appreciation.
ACS already offers a $2,000 bonus for harder-to-fill positions.
A new lawsuit has been filed against the city. Dr. Mompower, walk us through why this suit has been filed.
Yeah, there's a curious reality that the vice mayor has been attached to a large sum of money and an organization that she's a part of that we can't identify as a legal business entity or a nonprofit. And we don't know what's going on. We just like to find out. We made what we believe is a reasonable request for information and in a reasonable period of time, and the city hasn't come through, so there's no other option but to force it with a lawsuit.
You just want some information about how this money was given to this organization, why this organization, and what?
Perfect. You need to be answering the questions. You're good. Yeah. We just want to know why it played out this way, if it played out this way, if these entities are legitimate. We're not making any claims or accusations at this point. We'd just like to know more. You know, our leaders talk about transparency, but it's not always the case.
I guess the group is concerned about how this money got spent. It's a lot of money. It's taxpayer dollars.
Right.
The public has a right to know why it was given to this organization?
Well, you know, we live in a time where a lot of government entities feel free to, step around. Let me back up on that.
Protocol?
Yeah. We live in a time where government exerts a lot of power, and sometimes they're careless with the law and with their decisions. And we're concerned this might be one of those times, and we need information from them to make that determination. And if there's nothing to it, great. If there is something to it, they need to be held accountable.
You believe the city owes it to the public to turn over whatever documents they might have about why this decision was made the way it was, because it was made behind closed doors at a council meeting?
Transparency is not just a nice thing, it's a necessary thing. And for government to work and for us to trust government, we need that transparency, and that's all we're asking for now.